So we are going to jump in with history information, getting the right deals, intake information, and what it means. There's so much information that comes at us, both in terms of the history forms that we get, the intake, and every little moment that happens within sessions, every word in every email. I mean, it's really an information overload, and sometimes we can go too far in terms of interpreting and trying to establish too much interpretation from what we're getting, and other times we're probably missing stuff. I don't know that there's a perfect balance, but my goal in putting this together is just to try to not only kind of establish what I think is a kind of a basic level of information, but then also looking at some of these little specifics, like how might we really launch ourselves forward with a particular case by really thinking about the information that's already been given to us. Now, this does kind of play a little bit off of some of what we talked about yesterday, for those of you who were with me for the general session, in that, when we're talking about client comprehension and their ability to relay information correctly, if we're basing this on the information they've given us, let's say in a history form or the answers to our questions, there are going to be some assumptions here that the client, knows what they're seeing and that they're relaying information accurately. So that's kind of how we're making certain assumptions as we go forward from this. If we're not getting great coherence between the information and what we're seeing, then that's going to take us back to yesterday and how we kind of navigate some of those issues. So these kind of dovetail right back together with each other. So let's get started. So when I'm thinking about just a basic overview of the information that I want to be able to get, I'm going to start out with signalment, which is on the veterinary side of just the overall individual animal information. And we'll talk through that. We'll talk about what I'm referring to here as the W's, and then we're going to go through a lot of additional information, these factors as well as some others. And we're going to look at this both from the standpoint of just information itself, and then also look at some history forms and a couple of videos as well to see all the different ways in which we can gather information along the way. So signalment. So again, I don't know that this is necessarily a word that's used as often on the training or behavior consultant side of things, but for the veterinary side, signalment basically refers to all of these other details. So who are we talking about? Age, gender, breed, all of those sorts of things. So all of these pieces sort of get rolled up in. Now the nice thing about this is that it's going to take us longer to talk through each of these information details than it is for you to gather that information, right? So on whatever intake form you have, it's a 2-year-old spayed female basset hound. Got it. We've got all of our information right there. It's just sort of taking that little moment to think, what does that mean? So if we're thinking first things first about species, are there any differences at all between cats and dogs? None at all. Awesome. So let's move on. No. Right? So we think about what are those things. Now, from a learning theory standpoint, can we use, let's say, all 4 quadrants of learning with both species? Sure. Can we use classical conditioning? Can we use operant, conditioning? Absolutely. But if we're looking at, let's say, species-specific normal patterns, or if we're looking at body language cues, for example, does an elevated, upright tail means something different for a cat than it does for a dog? Completely different, right? Tails up over the horizontal on the dog side typically indicate more of a sense of arousal, in some cases more offensive behavior. In the cat, that vertical upright tail, especially with that little sort of question mark, is really an immediate message that says, I'm willing to interact with you in this moment, in this context. And it usually implies more of a softness, a looseness, and an overall ease or comfort. So if we're working dogs, for example, and we're starting to bridge into cats, that's a really important distinction to know, and vice versa. So you've got to know the species that you're working with as best you can, so you are able to understand what is normal for this species and what is not. Now, if we start moving then over to breed, let's say we've got 2 of these dogs who have given us a really strong, direct, sustained stare. I can think of 2 dogs on this little cluster here where I'm going to interpret that very differently, right? If that border collie is staring at me intensely, I'm thinking, you're a border collie. If perhaps this is the dog who's staring stiffly, intently with some okay, shit. Okay, let's figure this out, right? This isn't going quite in the same direction. So their communication methods may be different. there may be patterns that are more strongly ingrained or more likely to be seen in a particular breed compared to another. You know, would it surprise us, for example, that if we're talking about dogs who are excessively oral or really, really hungry all the time, you know, we're kind of looking over on this side of the equation, right? That doesn't surprise us as much. Does that mean that every beagle eats everything in front of them? No. Not really, right? Almost always, but no. So the reason I look at these things too is that I'm always looking at my patient as an individual, but I'm looking at it sort of in a hierarchy, saying, okay, this is first and foremost a dog, then it's a border collie, and then it's Jake. So who is Jake, and what are the things that may be influenced by him being a border collie, and what are the patterns that may be more likely to be observed or easier to reinforce or, you know, more difficult to change, and then again back at that species level as well. So we're kind of moving fluidly back and forth between each of these levels. Now if we're looking at the age of the patient, you know, that may change things as well. So if we're looking at puppies, for example, the body language, the interaction style, the overall, you know, just behavioral repertoire is going to be perhaps a little bit different compared to the old man in the foreground. Couldn't be bothered with the youngsters, right? So age of patient may absolutely impact whatever. Give me a spot, give me my bone, it's good to go. You know, these are actually the two Mastiff puppies for those of you who are with me, I don't know, sometime this week. I showed you a puppy, the puppy who was in the yard sort of scavenging, that pica compulsive disorder dog. That's the lighter colored one on top. So this is kind of what he looks like in other contexts when he's not engaged in that ingestive compulsive sequence. So, you know, if we're looking at these particular behavior patterns, the way we interpret, let's say, a 5-month-old behavior, a 5-month-old dog's behavior may be very different from what we see for an 18-month-old, you know, in the prime of adolescence, for example. And then we get into that, let's say, 3 to 7-year-old where things are relatively stable. And then we might start to get out of that geriatric end of the spectrum where behavior change may start to happen in a slightly different way. This is one of my favorite videos just because, right? So age may matter. Now where this matters too, can we do anything about the age of the animal? No. Yeah, other than waiting, right? Allow for passage of time and cross your fingers, right? In other cases, again, if we're talking on the geriatric end of things, maybe we're starting to see some anxiety that's relative to sensory decline. Is that likely to get better with passage of time or worse? Worse. So age can kind of work for us or against us, and it's not a matter of it being good or bad, it's just awareness of what it is. Gender, on the other hand, you know, is something we can't really do much about, but we may start to see some gender-specific behavior patterns who can pee higher, right? I got this one! You know, gender may influence certain things. We see, at least from my perspective and what I've read and what I've seen in my patient population, I see more of a gender difference in certain behaviors on the canine side compared to gender differences on the feline side. So even within species, kind of keeping this all rolled up into one, gender may have different influences depending on the species that we're talking about. And then within gender, then reproductive status. So if we're thinking here on the male side, for example, some of those behaviors that are more characteristically male, testosterone-induced, maybe those things like urine marking or mounting behaviors in certain contexts, roaming, intermale aggression, for example. These are some of the things that may be exacerbated by the presence of testosterone. And so understanding and knowing the reproductive status of the animal is helpful in interpreting what you're seeing. Again, I'm not trying to establish any sort of emotional valence to any of this. None of this is either good or bad. It's just what is. So if we're looking at all of these individual details, again, whatever your intake form or whatever your computer record happens to be, you can glance at this very, very quickly and at least kind of form a picture in your mind. And then if the behavior of the animal matches up with your expectations, awesome. We're that much further ahead in the game. If there are significant differences, for example, going back to that Mastiff, and we say 5-month-old dog out in a play yard with another puppy, and we're seeing 0 engagement with the environment other than here, that's inappropriate for that age, that breed, that gender, that everything. So it allows us to establish more of a sense of congruency, yes or no, based on what we're seeing or expecting. Now, on the other hand, so now we're going to go through into more of the W's, as I refer to them, the who, what, where, when sorts of things. These are some of the additional details associated with the case.
How are you? She's performing. Okay, thanks. Bye.
So if we're looking at a case like this, now I haven't told you anything about this dog, right? All we know is what we see. If we're trying to fill in some of these details, who are we seeing? I can tell you this is about a 2.5-year-old mixed breed, fluffy little thing. She's a spayed female. Who is she engaging in behavior toward? Who is that directed toward? Cameraman. So whoever is videotaping, in this case it happens to be me, adult male stranger. What is, so if we're looking at that, the who part of this is not only sort of who this individual is, which kind of captures some of that signalment information we were just talking about, and then to whom is it directed. You might add another layer onto here. Let's say there were 5 people in the room, and it's only directed at one individual. Or this is a 4-dog household, and this is a behavior pattern that is exclusively engaged in toward this particular individual, or vice versa. So who is it directed towards? Who is perhaps not directed toward? Then we get to the what side of things. So what was this little dog doing? Barking. That's kind of the number one. Was the dog barking and standing still? No. So there was some movement. Was the dog rapidly approaching? No. What was the dog doing? So more backing up. And as I sort of moved back and forth, did the dog do a lot of forward and back movements, or was it more sort of maintaining consistent threshold, consistent bubble? A little bit more consistent. So this dog was maintaining about an 8-foot distance from me, and as I moved either forward and the dog moved back, I moved back, the dog moved forward. So this gives me a little bit more of a sense of what this dog is doing. I can also tie in some of the body language here. What does this dog look like? So if we're seeing ears back, tail up, tail down, the body posture is kind of what folds in here as well. This is a place where we're trying to get as much objective data as we possibly can. If we're asking our clients what the dog does, what does your cat do in these circumstances, this is the point of really trying to nail it down. And sometimes I'll tell my clients, pretend I know nothing about behavior and I can't see anything at all and I don't have a video. Walk me through exactly what this looks like in as much detail as you can possibly describe. I'll let you know if you're getting too specific, which never, ever happens, right? They tend to gloss over the big stuff. So this is something where we're trying to get that objective data, because if I'm relying on the dog is really, as you can probably imagine, this is a dog who is very, described as being very pushy, very assertive, very controlling, very dominant towards strangers in the home. And I was like, well, again, maybe not. But if I'm just relying on the owner's interpretation of that versus coming back to the objective data, we're going to be off track. And we'll talk about some examples of where getting off track can really, really hurt us just a little bit later on. So where does this behavior happen? Based on the video, where are we in this particular clip? We're in a home, right? So we might want to know a little bit more information. If the client has just provided this video for us, we may want to know a little bit more about, are we in your own home? Are we visiting somewhere else? Is this, a place that's familiar, but it's not where you live? Little things like that that may influence the patterns. For example, if this is a behavior that only occurs within the dog's own home, and if that's truly the only place in which this behavior ever happens, we should start to think about certain things. Now, is that because there's a more of a territorial motivation there and the dog has more of a sense of responsibility of responding to perceived threats? Is this a dog who is perhaps a little bit more confident? Maybe it's completely shut down out in public, and so when it's at home, it's a little bit more confident, a little bit more forward, a little bit more likely to engage in the behaviors that it's being motivated to do. Or is this a place where we have a dog that has been given the opportunity to practice this behavior over and over and over? So we've got the influence of rehearsal and reinforcement, owner reinforcement or even just environmental reinforcers over time. All of those things can be relevant, but they all have to pop into my brain if I think this is a problem that only happens in the home environment. So even just looking at that one detail allows us to really start to nail in. Now, if we're talking about those three different things, a dog that's primarily fearful but is more confident in the home, a dog who is more territorial in the home, or a dog who has more of a solid reinforcement history, would those three dogs get the exact same set of recommendations? No. There might be some overlap, but if we're trying to get at different pieces of behavior, we have to be able to customize, which means we have to be able to interpret accurately what we're seeing. So where does it occur? Where does it not occur? Is this a specific location, like we said, in the home, or generalized across all? These are some of the details that may be relevant for location-specific problems. In the where scenario, we may also be looking at trying to have a better understanding of what that environment looks like, sounds like, feels like, to understand whether there are certain environmental or social provocations that occur in that environment that may be more likely to elicit a particular reaction. So all of this gets sort of rolled in. When would be the next one? At this point, we can't tell a lot about the when, other than there's a stranger in the home, right? So this might, the when might come in a lot of different forms. It may be time of day dependent. Maybe this is a behavior that only happens, maybe not this one, but maybe the behavior that the owner is concerned about is something that only happens immediately prior to meals. Maybe it's a cat who, let's say, tries to trip the owner going down the stairs. Maybe it's the cat who is sort of, grabbing onto feet, but just prior to meal times. Those are the patterns where we may say this is a very time of day dependent issue. Is there any sort of contingent relationship to whatever the trigger is? So if this is a dog who's simply walking around the house barking sort of indiscriminately versus the dog that is elicited, where that barking is elicited by the presence of a stranger, there's more of a contingency there between a stimulus and the animal's response. And again, lots of different details. Is it affected by meals, by exercise, by sleep schedule? When we ask a client a question like, are there any changes in your... Yes?
I just have a quick question. I'm assuming, this is, in my context, this is what I do, at the actual consultation. Do you have, and you'll probably be getting to it, some permutation of this generalized in an intake form, or is this you're just fleshing out from?
We'll get that. So what I'm looking at now is kind of all of the information. It can come from a lot of different places. Some of it's going to come from the intake. Some of it you're going to look at that history form and go, wow, I need a whole lot more information. So it's going to come from a lot of different places, and we'll talk about some of the places where it comes from. Yeah, great question. So if we're trying to get, let's say, a very specific detail, let's say, is this behavior affected or impacted by exercise? Sometimes the clients are going to know that. I may ask the question, let's say I'm working with a adolescent border collie. What does this dog look like? Are there any specific changes in this dog's behavior when this dog is exhausted? Which allows me to get to a couple of different things. Is this dog ever exhausted? Was that ever achieved in this dog's lifetime thus far? Yes or no, in which case that tells me something about what the owner's intent is. Are they literally saying, I am going to run this dog until it drops to see what happens? Or are they saying, well, gosh, no, we've never been able to get it at, we've never been able to exhaust it, 15 minutes twice a day, just can't do it. Okay, now we've got some differences in terms of realistic expectations of what this dog may require. So I'm getting, even with that one question, I'm looking at it from a lot of different angles. And if the owner says, yeah, even after a 6-hour hike where we've climbed, 3,000 vertical feet and within 10 minutes of coming home, the dog is right back to doing the things that it was doing, that's more valuable information. In other cases, it gives me some opportunities to make recommendations. If we haven't tested that, maybe that's one of our triage recommendations. Let's see what this dog does when it's fully exercised. And I really want to stress on this particular detail, sometimes it's exactly the opposite, right? So we may have those dogs that go out for, let's say, a suburban walk, and it's sensory overload, and they come back and they are absolutely over-aroused for hours. In that case, is it a matter of exercise? Maybe, but what is the environment in which that's happening? And so can we perhaps give that dog a sensory vacation for a 1 to 3 week period of time, still providing exercise, still providing mental stimulation, but at lower arousal levels, to see, does that impact reactivity? Does it impact anxiety? Does it impact attention seeking? You know, what is the influence? And this could, again, go in either direction. Now, if we're trying to get the who, what, where, when, plus or minus the why, you know, this is a little bit more, well, there is a kind of a pro and con here. I love getting the owner's why. You know, why do you think this is happening? This is a question that's on our history form. It's also something that we ask relatively frequently within appointments. And as you saw in some of the videos yesterday, if the client has a distinctly different impression or interpretation of what's happening, unless I can shift that, they are going to hear something very, very different within what I tell them. Even if what I'm telling them is appropriate, you know, the dog who is interpreted as dominant, for example, if that's the client's frame of reference and I'm stepping in to say, we're going to do a lot of food reinforcement, we're going to try to make this dog a happy dog, and you know, the owner's kind of coming at this from a standpoint of, right now I think this dog's kind of an ass. And you're telling him to feed him? What? That doesn't make any sense, right? But if we can reframe the owner's interpretation of what's there, now that intervention has a chance to be heard and implemented. So it represents the owner's starting point, but we as behavior consultants, as trainers, as behaviorists, have to be very careful to remain objective. So I want to know that information, but I'm not going to let that information dictate what we do next. As you saw in some of the videos yesterday, again, I'm more likely to kind of meet that client where they are, but then I've got to immediately start moving them in the direction that I need them to move. So it's not about saying, oh, you think he's dominant. Okay, let's work off of that. You know, we can take that and move it forward, but we have to maintain that objectivity, thinking about data versus interpretations overall. And as we're looking at that why, I mean, this is important for a lot of different reasons. So, you know, if someone says, oh, my dog is jumping on people, do you immediately know why? All you know is the dog is jumping. Do you know why that dog is jumping? No. Lots of different reasons, right? Maybe it was reinforced. Maybe the dog is, you know, maybe it's a part of a learned greeting sequence. Maybe the dog is under-exercised. You know, who knows what it is? There's a lot of different motivations. And so if we get that, you know, that immediate question, hey, how do you help me with my dog's barking? And if we immediately launch into recommendations or strategies without getting at least a basic understanding of why that may be happening, we are just as likely, and in some cases more likely, to be going down the wrong path than we are to be actually providing good, solid help for that owner. And what I worry about, especially on the veterinary side, is that if we have an owner who has reached out for help, and I'm sure you guys see this too, they've reached out for help, my dog is barking, and we say, well, try this, try this, try this. And it doesn't work. From the owner's perception, can they say, hey, I reached out for help, they weren't helpful to me? That's going to be their perception. And it's not that you can't be helpful, but you weren't helpful. Or the owner heard something different, maybe they needed implementation support. So maybe the advice you gave them was actually good, but the owner wasn't in a position, they didn't have the skill set, didn't have the support to be able to implement it. So we really have to be careful to not get down these wrong paths. And that can look very different from one case to a next. So what are we seeing? Who is this dog? As best we can tell. Labrador? Looks to be, does it look like a puppy? No, so it's a somewhere adult Labrador. So that's who we've got. He happens to be a neutered male. So who, what is he doing? What is Lightning doing? Scratching. Where is that directed? Towards a door. Do we know based on the video what's on the other side of that door? No. Could it be a food closet? He's a Labrador. Of course it could be. Could it be the owner's bedroom? Could it be exit door? Absolutely. So we just know that it's a door. We have more questions that have to be answered there. Is this a relatively continuous behavior? Yeah, at least once it started, for the duration of the video, it's relatively persistent. What would we have to know in order to answer the question of whether this is truly a persistent, continuous behavior? A lot more video, right? So if we're looking at this behavior as, let's say, a moment or 30 seconds or so out of an 8-hour video, that's going to tell us a little bit more about the frequency, the average duration, the intensity. Does it change from one to the next or not? So who, what, where, again, we're in a residential environment, and we'd have to know a little bit more about that. Who, what, where, when. When is a big one. Do we see anybody else in this video clip? No. So we might be thinking this dog is alone. This is the dog who's scratching at a door. If I add the information that this is, in fact, the exit door to the home, we've got a behavior that's occurring as what we consider a separation-related behavior. Dog is alone, engaging in digging, exit door, relatively persistent once it starts. What would be sort of the knee-jerk reaction to say that this is the most likely problem for this particular dog? Separation anxiety, right? So do we know that that's the case yet? No. What else are we going to need to know? So if I were to tell you that we've got an 8-hour video, start to finish, which I'm not going to spend our time showing, because it's really boring. About 7.5 hours of that is the dog sleeping on the couch. With what you know about separation anxiety, would that be consistent with what you would expect? No. So immediately, this was a dog that years ago, it's an old video clip. This was a dog that was presented to me because it was non-responsive to treatment for separation anxiety. This was a time, if you think back to 2004, was video capability nearly as easy as it is now? No, so we didn't have the video at first. This was a dog where the owner was coming home to find the damage, the evidence of destruction on the door, on the carpet near the exit door. There were often times where the pillows were disturbed, other things might have been rearranged in the process. So it was a reasonable assumption based on available information. They moved forward with separation anxiety treatment. And yet when we actually got that video, we said, that's not what we're seeing. So let's actually use the timestamp, which actually wasn't accurate because nobody could ever remember how to actually set the camera. So we're like, okay, so 7:41 is actually 2:22 in the afternoon, and it's a PM, not an AM, and that's what we were dealing with there. And as it turns out, we're like, so okay, it's happening at 2:20 in the afternoon. What happens at 2:20 in the afternoon? My neighbor comes home from work. This is a really social lab. I'd like to come see you now. Right? And after about 30, 90, 120 seconds, dog goes back and goes to sleep on the couch again. When we figured that out, the owner was like, you know what? I'll be damned. That used to happen when this dog was, let's say, a 2-year-old. When I was home, I was working from home, the dog would go scratch at the door. I go, oh, John's home. Open the door, let the dog out. Dog goes and says hi to John, comes back and goes back to sleep. She's like, I'm not even on my radar anymore. For whatever reason, change of circumstances. So this is all a stimulus-driven behavior that has nothing to do with separation anxiety, which now we say, well, is there any reason that this dog is not responding to departure training and relaxation training and medication? And this owner is just busting their butt to try to make this all happen, and nothing's working because it's not the right intervention. Let's look at Scarlett. Nobody gets injured in this clip, I'll just tell you that.
Come on. Let's go.
The goal here is to get hold of the dog's collar. To get off the bed.
Come on. Come on. Let's go, kiddo.
Anybody feel bad for the dog?
Come on, sweet. Come on. Let's go, kennel.
Anybody get the sense this owner's a little tentative?
Come on.
Do you think they have a reason to be tentative? Yes. So this is a dog. This is a dog that was presented for owner-directed aggression. Multiple bites. Level 2 was the most severe. So contact, superficial injury, no full-thickness punctures. All in the context of physical removal from the bed. So this is a dog who is being given protocols for resource guarding. And so there's a lot of, hierarchy type stuff, not hierarchy, leadership type things, sit to say please, nothing in life is free, block access to the bed, those sorts of exercises. The dog is not particularly responsive to those exercises. So the dog comes in for an evaluation for owner-directed aggression. We start asking a few more details. So who are we dealing with? Scarlett, middle-aged, I think she's about 3 in this video, female spayed, Labrador. What is she doing? Well, we saw the video clip. She's trying hard. She's trying hard to diffuse threats, right? She's on the bed. That's where this happens to be. What is she doing? Where are we at? We're in a bedroom. This is their bedroom. When is this happening? This is a really important detail for Scarlett. When is it happening? When is it not happening? When I ask the question, does she do this every time she's on the bed? No. She sleeps on the bed with us. She's on and off the bed all day long. Most of the time we can say, Scarlett, let's go. And she hops off the bed and she's a happy as a clam little Labrador. Does she ever do this when she's on the couch? Can you oh no, we just nudge her and she hops right off. Does she have any other resource guarding episodes? Any food, toy, owner attention, proximity, tight space, anything at all? No, she's actually a pretty easy dog with the exception of this. Okay. Is that typical of most of the resource guarding dogs that we know? No. We usually see at least some red flags in other contexts to say that this is more of either a global behavior or at least is more consistent across contexts. And so for her, the question became, well, when does she do this? And this is where you really listening to the details makes a huge difference. What are the times when she's on the bed where this is going to be a problem? And so when we watch the full video, which I'm not going to play it from the beginning, the eliciting trigger is the male owner stepping into the bathroom, spritzing cologne, stepping back out, asking Scarlett to go to her kennel prior to departure. So this is the dog with separation anxiety and confinement aversion. The only time, truly the only time she shows any level of aggression is in the context of physical manipulation after she's recognized pre-departure cues. So is it any wonder that she's not responding to the protocols that are there? No, we've got a separation anxiety dog. So if we're thinking about that as our plan, and we say, well, gosh, the only time she does this is when she's on the bed, and the owner's like, and if we can just get a hold of her collar, once we have a hold of her collar, she's not aggressive at that point. She's resistant, and she kind of goes floppy dead weight, but she's not aggressive. So that's kind of why they're kind of trying to, if we can just get there. Food over here, can I get it? They've tried all of those techniques to kind of bribe and lure. I was like, well, what if, humor me, I don't know if this is going to work, but what if before you went into the bathroom, you closed the bedroom door? Block access to the couch. Does that avoid the aggression? They're like, yeah, that actually will. Does that fix the separation anxiety? No, but it maintains safety until we can, right? So I can treat the heck out of separation anxiety cases, both with combinations of medication and BMOD and all of that sort of stuff, as long as I know what it is that I'm treating. So in her case, we're really looking at really narrowing down to what is it that we need to address. So in both of these cases, if we looked at this and said, well, the most likely thing is separation anxiety, and it's not, or it's owner-directed aggression because of resource guarding, and it's not, we're off track. So what are those details that we're going to get from our history, from our available information that are going to give us a sense of what are we treating, what are we working on, what are we not working on? And these are just sort of examples of what we're seeing, but various types of aggression, are going to have different patterns. I gave you some examples with that territorial motivation, for example, versus fear-based behaviors. If we're talking about stereotypic patterns of a dog who is grabbing a toy and spinning repeatedly, for example, like we saw with Mac the other day, is that something that is truly a stereotypic compulsive disorder, or is this a dog who's under-exercised or has gotten reinforced? It's really, really being critical thinkers about what information would allow me to either keep moving in this direction or would shift me in a completely different one, and being really smart about what that means through all of these patterns as well as so many others that we're going to encounter over the course of our days. So we're going to talk about a couple of cases as we go forward, and my goal in doing this, now this is actually the first time I've done this approach to this, so if you have any feedback from me afterwards about whether it's helpful, not helpful, I'd love to hear it, truthfully. But we're going to talk about Jax first, Jax is a dog who, at the time of initial intake, and these are going to be little screen captures from our history form. So this is owner spelling. I understand that that's not the way to spell Jack Russell. You know, little things like that. This is the owner perception. So acquired at 7 weeks. Dog is 8 pounds, a tiny little thing. We've got a birth date. This is a dog that we saw, started last fall. So this dog was about 13 months when we first saw Jax. Came from a shelter, volunteer. As I was told, mother stopped feeding him at about 3 months. Interesting. So you got him at 7 weeks, but the owner stopped feeding him at 3 months. That doesn't make any sense, does it? No, so we're going to have to tease that out later. Like, what actually happened? That was weeks. Owner stopped feeding at 3 weeks, was given to the volunteer at that point. So volunteer had him for 4 weeks. Adopted him when he was self-feeding for 2 weeks, so basically from 5 weeks on. So we're starting to get a little bit of a time frame that makes sense, and there's potentially some physical development issues that we haven't fully understood yet and are not actually noted in the medical record at all. Owner description, he's very friendly, he loved to be picked up, curled up on your lap. That's her interpretation. Problem, at least right now, if I leave the house and someone is around, he will bark and cry like someone is hurting him. If they try to touch him, he will pee and poop himself. If you succeed on touching him, he will bite and fight. So there's a couple of things that are worrisome to me. Number one, this is an owner who's aware that this is a problematic situation. And at least based on, I'm kind of reading this, I don't get any sense of past tense here. This is still very much, yep, when I'm gone and people come into the house, this is what happens, which implies that this is an ongoing pattern, which means I need to provide information to this owner about what proactive management and avoidance really looks like. I'm already planting that seed in my head that this is an owner who's going to need help and may need additional sort of justification for why avoiding these problems is extremely relevant. And we also know that at least based on this, we don't have a solid awareness of threshold or a reason why pushing this dog to threshold would be problematic, not only from a safety situation, but if you succeed, kind of rings to that sort of winning-losing. So there may be more of an alpha dominance mindset here as well. You know, little things like that can make all the difference in terms of really getting a picture of where this client is. And then this last piece, what have we done so far? I had a trainer come to the house. I'm going to use that word very loosely here. Tried having someone contact him with no luck. Then he grabbed him, trainer grabbed Jax, forced holding him onto his lap. He called it flooding, so the person knew what they were doing. Very painful to watch. 3 rounds, 2 hours each. Jax screamed every minute of those 6 hours. And then the trainer gave up and said, "There's nothing I can do for you." And then I screamed a little. What did I say? That's a great question. So thankfully, I was reading this in terms of history form, and I wasn't, like I'm a little flushed now, even just rereading that out loud. I'm sure some of you are as well. So when I was talking with the client, part of the question was, I understand that you've tried some things already. I understand that it didn't really seem to work that well. What was your impression of that method? And just as a little aside, something that we didn't get into yesterday is anytime a client tells me something that I would, my initial reaction would be the, you have to train yourself to be neutral. And I really mean train yourself. You have to practice. Practice it in a mirror. Practice with a video camera. Train yourself and practice a canned response that you can pull out at a moment's notice. And then what happened? So my dog bit me and then I kicked him, and then what happened? Like literally just put it in there so you can move right on, because at that point it's just data. It's meaningful. But if you pause, like I said yesterday, if I paused with some of my owners and said, oh, well, we don't talk about dominance, we don't talk about alpha, I've not only interrupted the flow, but I've also potentially created a wall of communication between us. So practice it, practice it, practice it. You don't have to use the words that I use, but get something in your verbiage. And then what happened? How did he respond to that? How well did that work? Something that gives you that verbiage to just move right on through. You can always circle back around to it. So in this case, I'm looking at a dog who's still very young, and there's going to be some trauma, capital T, trauma in this dog's history. So pros and cons. He's young, which may make him more flexible, but within that young age, we also have significant trauma already. And the fact that this is something that is present from a young age may give us a little bit of a sense of not only whether there may be perhaps a genetic or a developmental influence on this or other reasons, but it's something that we're seeing there. I'm questioning, given this dog's upbringing, shelter, bottle raising, inappropriate nutrition perhaps from the mother if she stopped, interacting at 3 weeks, if we nail down that timeline a little bit. So I may have some of these early developmental factors that are there. According to the greater history, this is getting worse rather than better. So whatever we're doing is either reinforcing this behavior or setting up conditions in which the dog is being further sensitized and is continuing down this pathway. So we have a lot of changes that we need to make. There's this repeated 3 times, 2 hours each. Can you even imagine what that would be like to be that person and to think that that's the right way to go about this? Gah! And from the client perspective, the big picture here is, okay, so this happened. I can't do anything about it now. This is a part of this animal's learned experiences. I can't erase it. I can't do anything about the fact that it happened. But what I can recognize is this is an owner who recognized that it was painful to watch and for one reason or another didn't advocate for her dog. And yet, this woman adores this dog. So what's that about? What does that mean? Is it that sort of, I forget what the name of it, but is the expert effect? Well, I hired you to do this, so therefore I assume that you know more than I do. Is it that? Or is it her just saying, well, I don't know what to do, so we'll try anything? I don't know. I don't know yet, but it tells me that there's something going on there. And that she doesn't really understand kind of what this all means. So that's kind of where we started. So a little bit more of a picture of Jax and sort of what he looks like in a couple of different contexts. So the one on the left here, it's going to be a video of the owner giving medication at home.
Stop.
Perfect example of cooperative veterinary care. No. That's one example. So no aggression in that context. Does this dog look comfortable? No. Engaged? No. That's actually, the reason I put that in there is not because it's so important to see what medication looks like, but that's actually a good example of what he looks like in my lobby as well. When there's stuff happening, that is what he looks like. Within 3 seconds of walking into my consult room and closing the door, he looks more like this. What she's saying right now is not terribly important, so don't worry about the verbiage. Just watch the dog's body language. So this is him engaging in a hands-off manner. He doesn't really eat a lot of food treats, but he always checks them out. We get a lot of soliciting. He'll put his paws up on your knees. He's not overly avoidant. I love his tail. FYI, we're currently trying to place this dog if anybody knows anybody who wants a little Chihuahua who needs some help. This is what he looks like in other contexts. So that fear-related issue is very much context dependent, and it's very much tied to physical handling or the perceived threat of physical handling. As long as you keep hands off and manage him appropriately, he's kind of a delightful little dog. I can't take him, or I would, because I like this dog. But what we've learned, we worked with this dog for about 6 months with intense training sessions. There was some day training or in-home sessions. There was some work with the owner. She herself is, again, she's a delightful woman. I really adore her, and has made very little progress in her understanding or her implementation. She's just not budging, and I'm trying so hard. She's just not moving. The dog is continuing to get worse, both due to insufficient management and that owner skill. She's continuing to put him in over-threshold situations. That's the reality. So I need to get him out. And we just had an appointment literally last week to say, no, I can't advocate for keeping this dog in your home, and I need you to put his needs first, which is actually the key for her. She's been thinking about this dog and thinking, oh, well, I've made a commitment to him, so that is my commitment. I said, yes, your commitment is to him. So reframe this. Are you right for him? She's like, no, I'm not. Awesome. Now we can move on. Yes?
What would you say is kind of your percentage of how often you tell folks this dog isn't appropriate for your home? Because I feel like I say that a lot. I feel like it's kind of a failure on my part often.
Yeah, there's a couple of things in what you said. So number one, how often do I say that? Actually, not very often, probably a couple of times a year. I mean, truly a couple of times a year. I don't say it very often because I think in many of the cases, these are owners, especially by the time they reach the point of they're persistent, they've invested time and money and effort into this. They also have a bond with this animal. So this may be, for many of these cases, our best shot of moving this forward. So from that standpoint, I don't end up saying it terribly often unless there's a mismatch. I can't think of one case, with the exception of Brutus the Cane Corso, that comes immediately to mind where I said that during a diagnostic assessment, where I was looking at the initial information and said, nope, probably fewer than 10 cases over the course of 15 years. In that respect, though, if we've got a reasonable time frame, we worked with this dog over about a 10 to 12 week period with some mild supplements, just to see what we could do in combination with behavior model management, minimal change. We added in medication to see whether not because I think this dog necessarily needs medication, maybe he does, maybe he doesn't, but I was saying whether I could kind of balance out some of the deficiencies in environment and management. If I can get enough of a medication response, maybe we can still salvage this. And at that point, when I put him on meds, I said I'm going to give him 10 to 12 weeks, and if we're not seeing life-changing responses, then we're going to talk about whether he's going to stay. So relatively infrequently. The other piece that I will say, just to cap on the last words you used, and then I may feel like a failure if I have to say that, it's not your weight to carry. It's not your weight to carry. So I'm going to move on from there. Okay, so let's look at Nalu. Nalu, at the time of assessment, which is also relatively recent, is an adult male neutered Labrador. Born in 2010, just saw him earlier this year, so he's about almost 8, 7.5, 57-pounder. Got him at 3 months, so he's been in the home the whole time. 2 problems listed. First one, strong reaction to seeing another dog, barking, growling, bolting, lunging, difficult or impossible to redirect attention when it occurs. Very strange is that there have been a few dogs he doesn't react to. So not 100% consistent, but mostly that's the consistent reaction. Secondary concern, and this is level of concern on a scale of 1 to 10. We ask the clients to rate that just so I have a way to rank them if I need to. Sometimes they give me like 9 concerns, and I'm like, anything that's a 5 or below, not today. We got more stuff to work on. So, strong reaction to seeing another animal such as a cat or a rabbit while on leash, barks and bolts to chase them. 2 isolated problems. Everything else in the history form, that all of the other questions, and it's about a 6 or 7 page form, is all referencing these 2 particular problems. There's a section in there where we ask them what commands does your dog know, and they listed out all of these, and basically these are the answers. So almost everything is perfect. Couple of usuallys. The fetch needs work. Ironically, he's a Labrador, whatever. But everything else, creates sort of the perception of being a reasonably well-trained dog. Again, he's 7.5 at this point. Don't worry so much about the words on this. What I want to highlight here is this is a part of our history form where we ask the clients all of these different scenarios. Please indicate the frequency of your dog's reaction to the following situations using the scale. Never would be 1, so never ever happens. 5 means it always happens. And so in some cases, because I know the history form well, I'll even just look at this and kind of do a quick scan. There are certain things like these which indicate training history that I want to see 4s and 5s. The dog is always responsive. Almost everything else I'm looking for 1s or 2s. Anything that's a 3 or a 4 or greater is typically just something that flags for my attention. So I can scan this information very, very quickly. And so the relevant piece here, other than the dog reactivity, command responsiveness, a little bit of jumping, unfamiliar people, so that's okay, but it's never mentioned anywhere else in the home. So I'm thinking, okay, 7-year-old dog, okay, fine. A little bit excitable, social dog, let's see what happens. Again, this one, second page, a little bit of noise sensitivity, but otherwise lots of 1s. So we're really, all of this is typically what this means to me is we have a case where the concerns that the owner is coming in for are the isolated concerns for this particular dog, which I love seeing because it means that I'm really going to be able to target my therapy. We're going to be able to get into the meat of why they're here to see me much more quickly compared to when we have this whole list where we've got a lot of different things that we haven't done yet. So just from an overall picture, mature Labrador, straightforward problem, solid training foundation history, isolated context, no other significant red flags or owner concerns, at least that we can identify right here, right now. In my head, I'm thinking, awesome. I'm in, I'm out, we'll get the plan, we'll get them set up for BMOD, right? Anytime you catch yourself thinking, this is gonna be easy, I know exactly what I'm walking into. You're like, pause. So, also nobody gets bitten in this one. I understand that the audio on these is a little bit muddy. Someone yesterday gave me an amazing suggestion to start doing a little bit of closed captioning on these, right? I was like, that's a brilliant idea. Thank you, Mary. So that will happen for future versions of this. So know that I'm aware of that. I'll try to get any of the important dialogue as it happens, but we'll look more at the body language as we go forward here.
Perfect. Ray Handsome? Like, and you are free to let him roam. That is just fine. We'll give him a chance
Famous
to get
last
all
words, right?
situated here.
I just let him go.
Oh, well, fantastic. They didn't tell me that. Yeah, let's just, you need to stay here.
So his wife was out in the lobby. I didn't know that, so he goes to step back out. Again, nobody gets bitten. It's not any one of those things. I don't see much that's a way of concern here yet. A little bit of environmental exploration.
So I've got some questions.
A little bit exuberant with his greetings.
This guy, I know that you've got some concerns about not only his reaction he has to other dogs, which I heard when I walked by with my previous patient. Yeah. So I got a chance to hear exactly what that sounds like. So I've got a few questions about that, as well as some of the reactions to cats and rabbits and those sorts of things. So my first goal for today is to get a sense of sort of where we are, what we want to accomplish, and for me to start wrapping my head around what I think these patterns really are and what that looks like.
Pause for just a second. So if we're looking at this particular dog, and I'm picturing this to be a well-mannered, mature, adult, appropriately social, certain aspects of this already kind of go along with that, right? He's not overtly aggressive in any way. He's a little unsettled for what I would kind of expect. Again, the mental picture that I had in my head is not exactly what I'm seeing. So I'm like, what's up with that?
Part of that also for me is I'm looking at the information, right, in combination with everything else to get a sense of, what are the things that we need to set up to be able to see and figure out which interventions work, how much of that do we need to do from the beginning. Is this pretty typical for him with visitor planning?
Is this typical for him?
Mouthy, and that's typical for him too. And there's, I'm not feeling any obvious pressure or anything like that, but it's just that little bit
it kind of hurts a little.
A little bit of intensity there. Good. So we're going to work through those details. We'll figure out, what's important to see. What do we just sort of figure out along the way? We'll sort through all of those details and we'll take it from there.
So this is kind of orientation at the beginning of the assessment.
Is there anything that you want me to be aware of right off the bat that for whatever reason didn't make it on the history form or the intake information before I jump into some specific questions?
So that's a question, I'll repeat it back. Is there anything that you perhaps forgot to put on the history form that you think I should be aware of? So this is, I already know there's something there, right? He's a little jumpy with visitors. Is there anything that seems a little bit odd about the repeated sequencing of this? Like most of my patients at least will get one or two little greetings and then they're able to disengage and the arousal immediately starts to drop off. The fact that each and every time he engages me, it's that same repeated high arousal, mouthy, jumping behavior is a little bit, I'm not going to say pathologic, but it's not the expected thing for a dog who truly has an isolated concern of dog-to-dog reactivity and in more predatory chase type behaviors. So this is me basically giving the owners an opportunity to come clean. Is there anything else that you want me to know about? Just straight up, open-ended question. No, not at all. We're pretty good. Okay.
Yes.
Including everything.
Yes, it absolutely is, and that's going to help me out a lot because I think that there's, with the way way that you answered the questions on there, I don't think there's a lot of additional information that I really need. Question for you, as I'm watching sort of this reaction for him, are there other situations? I know about the dogs, I know about the other small critters, I know about visitors. Are there other situations that tend to get this same level of kind of vibrating energy for him, or are these really the three areas where we see that intensity the most?
So that's, again, coming back a little bit more specific. So you're hearing me ask the question multiple ways. I've asked you in the history form, what are your concerns? I'm seeing this, giving you the opportunity, is there anything else you want me to be aware of? And then coming in more specifically. I'm seeing, I'm feeling this vibrating energy, this mouthiness, this mouth pressure that's there. Let me ask you specifically, when we think about that, are there any other conditions other than this, and this, where you would expect to see this particular arousal level? So again, trying to get it from different angles. And for a lot of clients, by the time you've asked the question, let's say the third time in a slightly different way, they're like, oh, now that you mention it. Sort of, again, planting that seed, giving their brain time to kind of roll that around a little bit, and then re-asking the question sometimes yields different information. Yes?
Chris, is it unusual that these owners are not trying to stop him?
It's a great question, Gail. So is it weird that these owners are just kind of passive? Which is ironic because some of the videos I showed you yesterday, like you're seeing all of my passive owners, like all in one stretch. It's not necessarily the norm. No, but that was something I was looking at as well. So they're not alarmed by this. They're not particularly proactive or embarrassed. It's just like, yep, here's what he does. There's none of that at all. So if I feel that that's going to be an issue for them, the place where we ended up kind of having to, where we are incorporating this in, is again teaching them more proactive management. What would this look like? And in fact, a little bit later in the appointment, we did try on a thunder shirt for him. So we used that as a scenario. I went to do it, and the dog's arousal level started to come up. She said, well, are there any behaviors that he knows how to do that may give him a little bit of focus? Can we set this up differently? So we're starting to create those opportunities to show the owners, if you intervene beforehand, the entire experience can be that much more productive. But it's not a natural skill for either of these owners. Ironically, so one of my trainers has been doing twice a week day training sessions because, again, working on impulse control, arousal, and then dog-dog exposure work. So she's doing day training sessions. Both of these owners are retired. They're there for every single day training session, which for those of you who do those sessions where you kind of typically expect to go in, work the dog, and leave, this is sort of what it looks like. She's working the dog with the owner's presence, which is a little weird. It's a little weird, but they're like, yeah, we're just happy to absorb. And the fact that they are so passive still allows it to work, and we're making more progress that we would normally make within day training, but because the time we get to a transfer session, they've heard it and they've seen it. Now they just are being coached on how to do it. So it's not necessarily a model that I would typically advocate for, but because of their passivity, I was okay with it. Yeah. Yes? So do they think that this is normal and that's I don't know if I think they recognize that it's abnormal for a lot of dogs, but it's completely normal for Nalu. Yeah, I don't think they've actually gone as far as to say whether this would fit, because they've not had a ton of other dogs in their home. So I don't think that they've even really thought about that, but it's normal and customary for Nalu, so it wasn't on their radar to report. Now, interestingly enough, when I went back to the RDVM, the referring veterinarian on this, and I said, hey, I've got some additional concerns in addition to the ones that Nalu came in for. And ironically, the DVM who used to see Nalu in the clinic is now working for me doing behavior assessments, so she's actually very good at this. She was like, oh my God, that's been Nalu ever since puppyhood. And he's one of those dogs where you know it, you manage it accordingly. As long as you give him proactive management, he's actually really easy to handle in the clinic. But she was not aware, she was aware of how Nalu was in the clinic. They had never expressed any of the concerns of what was happening outside of the clinic. So it was just like, well, we can manage him and you don't have any problems. So there was sort of this disconnect between what the owner was seeing and what was being seen. And once we put the pieces together, he's actually responding brilliantly. He's a smart dog. So we're working on impulse control exercises, trying to create a little bit more of a foundation before really pushing on the dog-dog reactivity and some of the chase-related behaviors. So again, different examples of how to get information in different ways based on questioning, based on observation, based on video. So when we're thinking about big picture again, we're going to move away from cases here for just a second. what are some of those other things that we want to be aware of? And whether we're asking for them within a history form, whether we're watching directly, whether we're asking the client to relay what they see, what does the animal look like when the sequence is occurring? And what do they look like at other times? It's not just about where the owner is concerned. I really want the big picture, and we'll come back to that in just a little bit. So what's the target, what's the duration, the intensity, what's the context, what's that antecedent behavior consequence sequence? All of these things may be relevant. Where I think it gets a little bit tricky, in addition to the stuff at the bottom about not going into that interpretation or client impression piece, is that we don't always need every single detail before we move forward and start with interventions. The trick is, at least in my experience, you may have a slightly different impression on this, but I think the earlier we are in our career, the more tentative we are, and we want to get all of the information before we move forward. And that's relevant. And I think the earlier you are in your career, the more time you should spend on that, making sure you've got as much of the information as you can. But then also recognizing that the more information we have, the more we have to kind of sort through and work out. So there is this sort of balancing act of this. We could literally spend 3 hours gathering information, but then we still have to do something about it. That's probably too much time. But yet if we start giving recommendations within 3 minutes, we're probably premature. And your comfort level of where you get to that point is going to be based on your own experiences. If you've seen 100 different dogs that show a certain type of reactivity on leash, for example, you've got a reference, right? You're like, I've seen this 100 times. How is this dog similar or different? And you're going to get to that point of understanding what to do next a whole lot more quickly than if you're seeing a particular pattern or a particular species for the first or the second or the third time. And I remember when I was going through my residency training, I remember going through, so I had been in general practice for a couple of years, doing some degree of behavior consulting and doing some training work on the side and just building my own skill set. And I went back into residency, and I remember going through the first, probably 30 cases or so, kind of deer in the headlights. Like, I'm not sure that I'm qualified to do any of this. Like, I don't know what I'm doing, right? And so then by the time I got to probably case 150 or so, I was like, I got this. Cruising, I got my routine, I got my rhythm. I'm seeing 6 to 8 diagnostic cases a week. I'm getting a rhythm going. I think I saw in that first year of the residency 190 diagnostic cases, I think, and then with all of the supported follow-up, and it was a busy year. So we were working through all of that, and then I hit a point around, let's say, I think it was probably around case 170 to 200, somewhere in that range, where I had started to get almost a little bit cocky, and I was like, oh. It'd be like a NALU case. Oh, we're going to do this. And we kind of just jump right into treatment. And then I got burned a couple of times. Not physically, but got burned on a couple of cases where I jumped in too quickly. And I started thinking, well, wait a minute. What I thought was predictable and consistent isn't always. And so then for that next probably 200 cases, I was almost a little bit on my heels a little bit. I was really tentative, really wanted to make sure that I had all of those details squared away. And then somewhere around case 400 or so, 350 to 400, I got to the point where I was like, okay, these are the simple ones, and these are not. And again, you get to that point, and a lot of you are probably experienced that in your own careers as well, where you get to a point where you're like, yeah, I'm able to tell more quickly which are the ones that we're going to be able to just dive in and focus very specifically, and which are the ones where we really have to broaden the net, where we really have to think on all of the different pieces, and you get the frame of both. I would love to say, for those of you who are kind of a little bit earlier in your career, I would love to say that there's a way to speed that process up. There is not. You just got to go through it. So getting that mentorship, getting education opportunities like this will help you get there, but you have to do the work in order to get better at it. There's no substitute for that. So with that being said, as we're looking at some of these additional details, what are some of the other things that may be relevant for individual cases? So the physical environment, for example, if we're looking at Godiva, so this is a doodle. You know that already. So this is Godiva. This is her front yard. There is invisible fencing perimeter about 2 feet off of that walking path. Not exactly the way I would have done it. But what's important here? So if I'm looking at Godiva and the primary complaint was bites to people entering yard, would this be an appropriate way to manage said dog who is biting? Granted, level 2 bites, awesome. So we're not getting injurious bites at this point, at least not significantly, but there are multiple. So I'm looking from that particular, if I know that that's the concern, especially when the owner has already localized it to a particular environment, I want to know more about what does that home look like? What is the neighborhood? So even just with this quick little 30-second video, you know that there's a walking path directly in front of the house. You saw a couple of cars going by, so you know that it's a moderately busy neighborhood, at least at this time of day. You know that at least based on the way the video angle is shot, this isn't a particularly deep yard. It appears that she's respecting the invisible fence boundary, and that is consistent with her history. All bites have happened when people have entered, and there's never been any episodes of her breaking through. Doesn't mean it won't happen. But we know as well that if there isn't a physical barrier, anyone is able to walk in and say, oh my gosh, she's adorable, right? And all it takes is stepping 2 feet off the path in order to get into range where she may end up having contact. So I want to know more about the home and the neighborhood. I want to know when and where this dog is in terms of yard access and what she's doing. In this case, we've got the video to show that. So I may be thinking, okay, if this is what our front yard looks like and it's a relatively short front yard, more wide than it is short, or more than wide than it is deep, what would the backyard look like? Well, the backyard actually is also very similar. It's wide, more so than deep, and this is a golf course home. And there's one of the tees literally about 12 feet off their back property line. So they've got the golf carts, they've got the golfers, they've got the people stepping into their yard to retrieve golf balls, right? Okay, so maybe Godiva doesn't get the yard anymore. You know, maybe we're talking long line. Maybe they can't do traditional fencing because of HOA issues. So not an option. So how are we going to manage that dog in terms of her yard access? So what do we talk about in the inside? We're going to put her inside. Follow up with the question, if she's inside and she sees those same triggers, what does she do? She charges back and forth from window to window and positions herself at the window so she's ready to react to the things that she sees. Okay, so that's a problem because we also have a toddler in the home, which we'll get back to. She gets along great with the toddler. However, if the toddler happens to be behind her, as she flies off the window seat to go to the other window, toddler goes flying, right? So what is she seeing through the window? What is the size and the layout of the home? It's a golf course home. It's huge. It's like 5,000 square feet, huge windows. So is it practical to think that we're going to block every single window of the house on all 3 levels facing the golf course? Probably not. So I need to know all of this information. So can she be confined? What does this look like? Can we block her away from windows? It's all of this troubleshooting before we even get to the treatment side of things. All of this information, this is what I'm scanning for. When I walked into that first front yard, knowing her history, this was this is all kind of going through my mind. What are my options? What are my windows? What are my views from dog perspective? What do we see? What's the busyness level? What time of day is it? Is it weekday versus weekend? Got it. So it's all just a quick mental scan. It's not necessarily even anything that I had to ask the owner. It's just. It's being aware enough to think about these details and what they potentially will mean. So if we're still talking about the physical environment, if there's a particular individual that's more likely to be targeted by that behavior, what's the exposure level? If it's something that's related more to resource guarding, perhaps where and how is this animal fed? What are we looking at for exercise schedule? What are the dietary needs of the animal? All of these things become relevant for the physical environment, some of which we'll get on our history form, some of which we'll have to observe or ask about. Social environment, who lives there? Are we talking about a mixed species household? Are we talking about a multi-animal household? If there are individuals present, either, again, intra or interspecific, are they familiar versus unfamiliar? What's the bond? What's the socialization history? This takes a little bit more time to get through. This captures some of the things we were talking about yesterday in terms of the role of the house and the pet in the household, but these are all relevant details. So what else do we want to know? Now, I think, I could spend a lot of time going through all of this, but I may even just start out the question. Tell me about a typical day in the life of your pet. And then just see what they give me. So I'm not only getting the data, I'm getting what level of detail are they able to relay, how efficiently can they give me information, what do I need to follow up on, how is this actual exchange going? And I can get a lot of information, at least the things that are relevant from the client's perspective with 1 or 2 questions. So let's look at Penelope. Penelope, at the time of assessment, so she was born November of 2015. I saw her first in the fall of 2017, so she was about 2 years old. She's a 150-pound English Mastiff. Household consists of the husband and the wife. So the wife is the one who's the primary caregiver. She's the one who's filling out the history form. She's a stay-at-home mom. She is a licensed veterinary technician. She's not currently working. Her husband, mortgage lender, long hours away from the building. So, if there's anything that I need to get implemented, it's more likely to be the female owner in this case. And there is a toddler involved in the home as well. So that's kind of our scenario. Important details here: first incident, most recent incident, when, how often does it occur? These are just different scenarios. The primary concern on a walk in a quiet neighborhood: she sees someone on the other side of the road, she gets excited, she has drugged me across the road to go visit them. That happened about a year ago, so she was about a year old at the time of the first incident. So this is automatically telling me I've got a big dog, I've got an owner who's going to need help with physical control. That immediately goes into my head. We have an owner who not necessarily doesn't have the strength, but may have needed additional help with tools or coaching on tool use to be able to maintain control. In a walk in the neighborhood, we came upon a blind corner, so it tells me that we have environmental triggers that the owner doesn't know how to avoid yet, or at least didn't at the time of this happening, but this was the most recent episode, the one that, one of the ones that led them to come in. Owners were walking dogs off leash. Another red flag for the neighborhood. So I'm getting some of my physical environment even reading through. One dog ran when it saw Penny. She got excited, chased, pulling me down until I let go of the leash to prevent me from dropping it further. I'm no longer walking her since finding out I'm pregnant. Toddler, pregnancy, pulling down. Husband says no. Protective mode kicks in. He's like, you are not walking this dog. I'll do it. I'm not sure when. And these are actually friends of mine. This is not accurate. He's away from the home 12 to 14 hours at a time. He's busting his ass to build his business right now. He's doing a beautiful job of it, and he's just not available. So, and no judgment on that. That's just the reality. So I can't really count on him in that scenario to step in here. So the other detail: anytime she sees someone or another dog that shows her any sort of attention. So now I'm getting information about what the stimulus is that elicits that reaction. It's not specific to dogs. It's any real arousal trigger for her, which makes me start to think, do we have a dog with other reactivity, impaired impulse control patterns, versus a dog who's more fear aggressive or showing some of those other patterns, because it's so generalized. I don't know the answers to that, but that's some of the things that I'm thinking about. So in this case, we tried using treats to help her focus, reward her for not going crazy. We also try to avoid situations, but they haven't been terribly successful. So there's an attempt. Tells me that she knows that it's important, but will need help on actual strategies in order to be successful. With my pregnancy, I no longer feel safe walking her in public. I'm too afraid she'll get excited. So verbiage, excited, she's not seeing this as an overt aggression problem, and I'm not getting any verbiage that says she sees a sign of fear or anxiety. She is a licensed vet tech, and we're very exposed to fear and anxiety, more so than other behavior problems. So if she's not seeing it and not reporting it, I'm going to assume until I know otherwise that's probably accurate. So we have a dog that's more excitable in social situations, off property, and there's a physical control problem. Does that allow us to really start to narrow in on what our likely initial interventions need to be right from the start? Right? Oh my God, I just want to squish them both. So this is Penelope. This is actually with the baby she was pregnant with. This is Hudson, their newest son. This is Penelope in the clinic. She is a marshmallow. I absolutely adore this dog. I really, really do. So this is her in the clinic. So these are the things that we know even going into this. Female owner, caregiver, injury potential, reactive to multiple triggers, got to get some proactive management on board, open to the use of food reinforcement. She said she was already taking food treats out on walks, so I'm not going to have to sell her on that. One other detail that is relevant, though, is this dog does have a lot of GI issues, IBD, IBS, so we can use food. We just have to be really strategic about it until that gets all sorted out. And then some of the other factors that we've identified. In the interest of time, because I talk a lot, I'm going to skip these videos for right now. I'm happy to play them for anybody else later on, but I want to get through some of these other cases as well before we wrap at 10:15. Yeah, 10:15 is our time. So basically what we ended up doing is I knew this going in. I said, Sierra, who is the female owner here, I said, you used to use a head collar for Penelope, right? She's like, yeah, she hated it. We didn't love it, so we got rid of it. Bring it along, please. So we basically, within these 2 video clips, we fitted her with the head halter. She actually did beautifully well with it. They had it misfitted the first time around, so she did hate it. It was just a fitting issue. She actually acclimated very, very quickly. Within first session, we had it on in about 6 minutes. She was leaving it alone. We immediately went into leash control. So we initially went into, even in this little room with a Mastiff, working on a couple of things, teaching her how to actually leverage the gentle leader. And again, do I want to be able to use my physical tools without having to rely on physical control? Absolutely. In the short term, she needs physical control. She needs physical control. This dog needs exercise, and she has to be the one to do it. So we're going to go in a slightly different direction. So she was taught how to leverage that 90-degree to the side leash pressure to be able to turn Penelope. We practiced even in this little room, especially in this little room, how do you actually move into her to turn into her and turn her around without being inappropriate or aggressive about it, but actually just practicing, where do you put your hand? Before you turn, it's not a matter of just barging into her and expecting to get her out of your way. How do you kind of plant your hand, pivot around her, and basically just bring her around? We practiced doing a pressure sit for her where we're getting just that little bit of upward, consistent pressure on the gentle leader combined with the verbal sit. The moment she puts her butt on the floor, the leash pressure goes away. So we're using negative reinforcement to get the sit. Again, all physical tools, things that I wouldn't ordinarily start with, but they're critically important for this particular case. And so within about 15 minutes of practicing that in here, we went out in the lobby and we worked her in patterns. We worked her out in the parking lot. And so literally within about 30 minutes, she walked out of there, she's like, I got this. Completely changed their lives. Yes. And you know what it's like to work with friends, right? There's no pressure at all going into that, hoping for the best. I did one follow-up session with them at their house just to say, let's make sure you've carried that forward. It was really more to get her husband on board as well. It's like, let's do it on a weekend. I'll come over. We'll go grab coffee afterwards. It's fine. We did that, practiced that through the neighborhood. We went for a quick walk. That was it. Complete game changer. She's a delightful dog. She's got some impulse control issues. Maturity is helping them out a lot. Anyways, so that's where we were with Penelope. But it's all about identifying those problems to know exactly where we need to go. And we didn't have to spend that much time to do it once we knew what it needed to be. So I'm going to skip those for right now. Other things that we may want to know over the course of our history, what's changing? And this may happen in all sorts of different ways, and I may get to that, and you've probably heard me say this over the course of the weekend already. We've made an intervention. We're watching to see what the animal does. Better, worse, no change. That's something that I stole from Karen Overall years ago. It's just better, worse, no change. And clients get that. Now, what makes it better? What makes it worse? Are they able to evaluate to say that there's no change? That's sort of the sidebar to all of this. But I have to ask the question. So we added in the medication, we changed the medication, we added this particular training exercise, we put the window block up on the back windows. What do you think? Better, worse, no change? And the clients get used to asking that, and with a little bit of training, they're starting to report, we did that and it's better. We did this and I can't tell the difference. We did this and I think it actually made things worse. Can we stop that, please? Yes. So we're looking at changes over time to figure out, are we on the right track? Scruffy is another case that we're going to go through quickly. He's been in the home since 3 months. Female spayed Cairn Terrier, just saw Scruffy for the first time end of last year, so she's about 10 years old at that point in time. Long history, but what I want to emphasize in here with the cute little picture of Scruffy on her settle mat, or kind of on her settle mat, we're working on that. Always had a problem with fireworks, so this is a long-standing issue, and yet dramatic change of behavior after the 4th of July that's no longer getting better. And so this was a letter that was written at the end of July. Her normal pattern over the course of years has been she would dive under the bed, comes out about 2 hours later, so self-recovery without intervention. I think it got to be too much for her, so again, now we're getting into interpretation, so I need to just listen and read carefully. But the owner's describing she has very little affection, kind of a flat affect overall. We used to have a routine where she would sit in my lap, now she never does. She usually initiated play, and now she does not. Her joy seems gone while she's at home. I've had her checked by her regular vet and her rehab vet, so I've got a client who's open to lots of opinions. She's got multiple people who have looked at this dog already. I know that there's no physical problem going on. Really? Do we know that? Not yet. So this is sort of where we're starting from. So we've got an owner who recognizes that there was a pre-existing issue. It's dramatically worse. It seems to be worse since the 4th of July. And we've got these other patterns. So is it isolated to the noise reactions themselves? At this point, it's not. So I'm thinking about all of these different issues. She's a mature dog, previously stable noise aversion, pre-existing behavior issue, recent worsening. So I'm thinking, is this trauma? And we're getting more of a generalized anxiety response because of the intensity of that trauma. Or is there something else that changed the way she responded to noises and is also eliciting some of these other behavior changes? So it's kind of a chicken or the egg sort of a thing. Is there something else that's causing everything, or did this thing cause this thing? What's the relationship between these factors? And I don't know that at this point yet. It's just a question. But I've got to be thinking about that going in. I've got an observant, attentive, interactive owner. There are multiple behavior changes, so I've got to be able to think that overall. And how are we going to approach this? So in this particular case, without going too far into this, we did look at her blood work. Her thyroid level was a little bit on the low side of normal, which I'm not going to start a whole debate about thyroid here today, or I don't want you leaving here thinking that every dog who's abnormal has a thyroid issue. She actually did. She was one of those suboptimal thyroid dogs that once we treated her thyroid issue, the energy came back, the attitude came back, her noise phobia reverted back to its previous baseline, which doesn't always happen. We got lucky. And we were able to then work on her actual noise phobia issue. So we're working through, the owner is now sort of working on her own on the strategies to address that, so that next year we're going to be in a much better place than we were so far. So that's Scruffy. Yes?
Quick question.
Yes.
You're a vet, so you could do that. What would we have been able to do? She's been to 2 vets.
Yeah. So in that case, what would we have done differently? If I had been in a position of not being able to say, I'm going to push specifically on this aspect, I would have gotten her started with behavior mod and just said, you know what? We're going to assume that this is all accurate. We've got a dog that for whatever reason was excessively traumatized by the 4th of July experience, which would be a reasonable explanation. That could look like this. So we're going to get her started with behavior mod. And depending on how you're communicating back to the veterinary clinic, that would be something that I would follow up on, either by saying, you know, thank you for the referral, or just wanted you to be aware of this since I know you've seen this dog recently. This is what we're going to be doing in terms of our behavior mod plan. In case the owner didn't bring this to your attention, I'd also like you to be aware of a couple of observations that I made within session. For a dog of this age, breed, pattern, her overall affect is a little bit on the flat side. I'm going to wait and see how she responds to the training exercises, but if not, I just want you to be aware of that in case there's anything else that comes to mind for you that you may want to screen for in a 10-year-old dog with a flat affect, low energy level. But I don't know, maybe there's something you should look for. So I think it comes back to communication. I think there's a way to do that response. Does that help? Awesome, yeah, I think it definitely, but it's going to be a different picture depending on your role. So what else do we want to know? What have they tried? I want to know what they've done in all of these different areas, and just even asking that question is going to allow them, how accurate do they give me information? What have they tried? What has been their intervention implementation? What's the response? Again, better, worse, no change. Did it work? And again, I will, even though I know the pitfall of asking, did it work? I still ask the question because I want to know how they answer it. If they're still coming in for a problem, if their history says this is an ongoing issue, I already know it didn't work. But if they think the intervention is working, then that tells me that I've got a perception difference that I have to be able to address in order to get them to do something different. So it's getting that information right from the get-go. Now, when you're working with that particular case, are you always going to get all the information that you want? No. Sometimes they don't know. Sometimes we can say, describe multiple instances and we'll see if we can put a picture together. In some cases, we're looking for some of those patterns to decide what to do next. And in many cases, especially if I'm walking away from a diagnostic assessment and I don't really feel like I know what's going on, I may give the client some homework of journaling. Now, what I'm very clear to tell them whenever I make a journal recommendation, I said is don't worry about making it overly detailed because you don't have time for that and I don't have time to read it. Make it bullet pointed. If you're a spreadsheet person, make a spreadsheet. Day, time of day, what did you see, depending on what the issue is that we're addressing, and are there any relevant details? And I really just leave it open-ended at that. And I tell the clients, don't try to journal the pattern. Journal the events. If there is a pattern, we'll see it. And that's a really important distinction because they go into it looking for something and they're automatically skewing their observations in the form of interpretation. So just journal data. And I may give them a couple of examples of what constitutes data versus interpretation. Dog reacted at 12-foot threshold, dog went ballistic. Different information. Yes?
When you're looking, for example, at like dog versus dog sort of thing, and you want them to journal, when these things happen, I know you're saying, like, don't be detail-oriented, but do you ever ask them to try to break it down if they have a dog that doesn't react to every dog they meet? Hey, was it long-haired, short-haired, large, big, breaks?
Right.
Do you ever ask them to go into that much detail?
We do, and so this will be something where I'll typically say, let's start with the basic journal. Let's see if the pattern's there. If it's not, we'll break it down. And part of that is that I want it to be accessible and doable for them. If I've got them in the habit of journaling events, basic events, if that's not good enough, this is already the routine. It's a whole lot easier for me to add a little bit of a detail to it than it would be to ask them to detail all of that right from the get-go, especially if I don't know if we're gonna need it. But you're absolutely right. If it's one of those variable patterns, we're probably gonna need to get to detail. What I also find though is with the journal, if the client has journaled the basic details, I find that their recall tends to be more accurate. If I need to say, hey, 2 weeks ago you noted this. What dog was that? And we may even just be able to quickly fill in some of those details to try to narrow down what, we think it's a size issue. For the next week, let's really just journal size. Or we think it's a color issue or a coat issue or an arousal issue. Let's just journal that and see where it leads us. So yeah, different levels of specificity. Yes?
How do you, in Chris language,
Yes.
how do you communicate to owners, this is a little off subject, how do you communicate to owners in your way that the dog is, you're not comfortable working with the dog, and also that
More from a safety standpoint?
concern for their safety?
Yeah, so I'm going to look at it a couple of different ways. Now, I will say that in my experience, there's relatively few dogs. There are out there. But I'm going to look at that from the standpoint of saying my goal in helping you, and this is going to change a little bit depending on where we are in the intervention process, is I may say, my goal is to help you. I first need to understand your dog, and it's really important for me that I don't add any additional incidents. I really want to get a sense of what your dog looks like when they're the most calm, because what really is valuable to me is watching that transition from being calm, relaxed, comfortable into just that slightest bit of concern. Seeing your dog at full threshold, full incident isn't really actually all that helpful for me, and it puts us in a really weird place overall. The information that's actually most valuable to me is actually down here. So then I'm looking at that to say, do we have a way of managing that animal safely? And there are some of my patients that I never touch. There are some of them that I'm never within 4 feet of because it's not safe to do that. And then the question is, that's the reality. And I'll ask the question, are you comfortable going forward with that as our limitation? So it's not about do I feel safe or not. I'm saying in order to maintain safety, this is the way we're going to do that. Is that comfortable for you? And so it's really, I think a lot of it is just being very matter of fact about the details. This is what's important. This is what I feel is necessary, at least until I get to know your dog a little bit better, and then we can go forward. I'll talk a little bit more about that later if we can get to it. I'm going to wrap up on the rest of the details here just to be able to make sure that we get through the last information in 30 seconds. Okay. If we can't put it all together, what do we do about it? We're going to have to spend some more time, right? Whether it's asking other questions, whether it's more time directly observing the dog. As I just mentioned, I don't necessarily want or need to see full intensity, despite what I showed you in some of those videos over the last couple of days. The goal is almost never to elicit the reaction, but we'll take advantage of the video when it's there. We're looking at all of these different details. And the last little reminder is remember the medical stuff. And I know you're in a position to not be able to be overly, declarative in that. And so how do we use some of that terminology that we were just talking about a couple of minutes ago? How do you share your observations without making recommendations? The way that the vet or the veterinary team receives that information obviously is on them, and we can't control that. But we can put it out there in hopes that they're going to be able to evaluate for those medical issues that are there understanding that there's a lot of different testing. There are some things that we consider more of a minimum database, and that will help us in some areas, but this whole customizing piece is where we really need a lot of help for some of these more detailed cases. And again, recognizing that in many cases, if there is an underlying medical issue, that may help us. If we address that, that may resolve the behavior consequences, but there's also this learning component. So what I love about, even the case we were talking about with Scruffy, is that if you're in that particular situation, you can say, I'm in a position to help you on the behavior side. If your animal responds appropriately, awesome, we're off and running. If not, or if the medical component really feels like it's still kind of an ongoing influence, we may need to revisit that, and we'll figure that out as we go. So there's ways of handling the communication that doesn't put you in an awkward position, doesn't put the client or the vet in the awkward position either. Respecting that boundary, what are you able to do? How do we make those communications back and forth? And where do we make our referrals to based on who you have in your area? These are all going to be relevant details based on all of that history information that we have as an underlying. I would love to take questions. I'm available for questions, but right now we're done.